Thanksgiving dinner had become my parents' medical consultation hour as usual. Dr. Robert Chin, cardiologist, and Dr. Lisa Chin, pediatrician, held court at the head of the table, dispensing professional opinions about everyone's health concerns like they were handing out prescription pads. Uncle Mike's cholesterol is nothing to worry about, Dad pronounced, cutting his turkey with surgical precision. Numbers like that, I see them every day. Just cut back on the red meat. And Aunt Sarah's dizzy spells are probably just inner ear issues, Mom added, her pediatrician voice warm but authoritative. Very common in women her age. Nothing serious. I sat quietly at the far end of the table, unconsciously touching the small surgical scar hidden beneath my hairline. 3 weeks post-surgery, the incision was healing well, but the memory of my family's reaction to my headache complaints still stung worse than any physical pain. What about Lisa's headaches? Cousin Jenny asked, looking at me with genuine concern. She mentioned having some severe ones lately. Dad waved dismissively. Tension headaches. Stress from her graduate program. Lisa's always been dramatic about minor health issues. Classic stress response, Mom agreed, not even looking up from her plate. I see it all the time with high-achieving young women. They somaticize academic pressure into physical symptoms. I almost laughed at the irony. My parents, both respected physicians, had diagnosed my brain tumor as headache drama and stress-induced somatization. 2 doctors who'd completely missed the life-threatening mass growing in their own daughter's skull. But didn't she have some really bad episodes? Jenny pressed. I remember you mentioning she went to the ER a couple times. Emergency room visits for tension headaches, Dad said, his tone suggesting this was proof of my dramatic tendencies. Waste of medical resources, honestly. A little ibuprofen and stress management would have solved everything. What they didn't mention was that I'd gone to the ER alone both times, after severe headaches left me with vision changes and vomiting. What they didn't know was that the second ER visit had led to an MRI, a diagnosis, and emergency surgery while they were attending a medical conference in San Diego. Lisa needs to learn better coping strategies, Mom continued. Graduate school pressure isn't an excuse for constantly seeking medical attention for minor discomfort. The minor discomfort had been a 3.2 centimeter meningioma pressing against my brain stem. The attention-seeking behavior had been my attempts to get help from my doctor parents when something was seriously wrong. I touched my surgical scar again, thinking about the neurosurgeon who'd saved my life. Dr. Patricia Williams, chief of neurosurgery at University Medical Center, who'd taken one look at my MRI and scheduled emergency surgery for the next morning. Lisa, you've been quiet, Mom said, finally acknowledging my presence. How are you feeling? Any more of those headaches? I'm fine, I said simply. The headaches have stopped. See, Dad said triumphantly to the table. Stress-related. Probably resolved once she adjusted to her coursework demands. If only they knew that my headaches had stopped because a neurosurgeon had removed a tumor from my brain while they were presenting their research on pediatric cardiology across the country. 3 weeks ago, while my parents were in San Diego, I'd woken up with the worst headache of my life, accompanied by nausea so severe I couldn't stand. The ER doctor who'd ordered the MRI had looked genuinely shocked when the results came back. Miss Chin, I need to call neurosurgery immediately, she'd said, her voice carefully controlled. There's a significant mass in your brain that requires urgent intervention. I'd called my parents from the hospital, but they were in the middle of their conference presentation. Can this wait until we get back? Dad had asked, irritated. We've told you before, these tension headaches aren't emergencies. They'd missed my surgery entirely. Dr. Patterson will handle everything, I told them when I called post-surgery, groggy from anesthesia. It went well. I'll recover at home. They'd assumed Dr. Patterson was some general physician I'd seen for my ongoing headache issues. They'd never asked for details, never requested medical records, never followed up with questions that medical professionals should have been asking about their daughter's health. The recovery had been challenging, managing post-surgical pain, attending follow-up appointments alone, dealing with temporary cognitive changes while my brain healed. All while my doctor parents continued to believe I was receiving treatment for stress-related headaches. I'm actually presenting some research at next week's medical conference, I said quietly, changing the subject. Oh. Dad looked mildly interested. What kind of research? Is this part of your graduate program? It's about patient advocacy in neurology cases, I said carefully. Specifically about family dynamics when patients have neurological symptoms that get misdiagnosed or dismissed. Interesting topic, Mom said, though her tone suggested she found it anything but. Though I hope you're not drawing conclusions from limited personal experience. Medical decision-making is much more complex than patients typically understand. The research is quite comprehensive, I said. I've been working with Dr. Patricia Williams at University Medical Center. She's the chief of neurosurgery. Patricia Williams? Dad's eyebrows rose. She's highly regarded. Surprised she'd work with a graduate student on social research rather than clinical studies. What he didn't know was that Dr. Williams had been so disturbed by my family's response to my medical crisis that she'd invited me to co-present research on medical family bias and diagnostic delays at the upcoming International Conference on Neurological Medicine. She's very committed to patient advocacy, I said. Especially cases where family members in medical professions create barriers to appropriate care. Actually, I continued, Dr. Williams specifically asked if my family might be able to attend the presentation. She said having medical professionals in the audience would be valuable for the discussion. Dad looked pleased. We'd be happy to attend. Always interesting to hear neurological perspectives, especially from someone of Williams' caliber. What's the presentation title? Mom asked. When medical training creates blind spots, family physician bias in neurological emergencies, I recited. Dr. Williams will be presenting several case studies. Sounds fascinating, Dad said. Though I'm sure most of these cases involve non-medical families who simply don't understand symptom presentations. Actually, the research focuses specifically on cases where family members are medical professionals, I said quietly. The data suggests medical training can sometimes create overconfidence in dismissing family members' symptoms. Mom looked slightly uncomfortable. Well, medical training does provide important perspective on differentiating serious conditions from anxiety-related symptoms. The conference is next Thursday at the medical center, I said. Dr. Williams asked specifically about physician attendance because she wants to discuss how medical professionals can avoid diagnostic bias with family members. We'll be there, Dad confirmed. Always good to support continuing education in the medical community. What they didn't know was that Dr. Williams would be presenting my case as the primary example of how physician parents had delayed life-saving treatment by dismissing clear neurological symptoms as psychological problems. Thursday evening, the University Medical Center auditorium was packed with physicians, residents, and medical students. My parents sat in the third row, looking professional and confident, occasionally nodding to colleagues they recognized. Dr. Williams took the podium looking every inch the distinguished neurosurgeon she was, silver hair pulled back, white coat perfectly pressed, the kind of presence that commanded immediate respect in any medical setting. Tonight we're discussing a critical issue in medical practice. Diagnostic bias within medical families, she began. I'll be presenting several cases where physician family members' medical training actually delayed appropriate care for their relatives. The audience settled in, expecting an academic discussion about other people's mistakes. Our primary case study, Dr. Williams continued, involves a 26-year-old graduate student who presented with classic symptoms of increased intracranial pressure over a 6-month period. She clicked to the first slide, a timeline of symptoms I'd reported to my parents. The patient experienced progressive headaches, visual disturbances, nausea, and episodes of confusion. She sought medical attention multiple times, including 2 emergency department visits. My parents were listening intently, probably thinking about similar cases they'd encountered. However, the patient's family members, both practicing physicians, consistently dismissed these symptoms as stress-related tension headaches and anxiety. Dr. Williams clicked to the next slide. My MRI results. This is what emergency imaging revealed when the patient finally received appropriate medical evaluation. The auditorium went silent. The MRI clearly showed a large meningioma pressing against my brain stem. A 3.2 centimeter tumor that required immediate surgical intervention, Dr. Williams announced. The patient underwent emergency craniotomy and tumor resection. I watched my parents' faces from across the auditorium. Dad had gone pale. Mom was staring at the MRI images like she was trying to decode a foreign language. The concerning aspect of this case, Dr. Williams continued, is that the patient's family members are a cardiologist and pediatrician who repeatedly dismissed clear neurological symptoms as psychological problems. More slides appeared. Documentation of my ER visits, my attempts to get my parents' medical attention, their consistent dismissal of my symptoms. The patient underwent surgery alone because her physician parents were attending a medical conference and considered her symptoms non-urgent. This case illustrates how medical training can create dangerous overconfidence in dismissing family member symptoms, Dr. Williams said. The parents' medical expertise became a barrier to appropriate care rather than an advantage. Dr. Williams paused, scanning the audience. I'd like to introduce my co-presenter, who will discuss the patient perspective in this case. I stood up from my seat in the back of the auditorium. The walk to the podium felt like a mile, passing rows of medical professionals who were just beginning to understand that this wasn't an anonymous case study. Thank you, Dr. Williams, I said, stepping up to the microphone. I'm Lisa Chin and I'm the patient in this case study. The auditorium was silent except for the sound of my parents' sharp intake of breath. I'd like the physicians in the audience to meet my parents, I continued, gesturing toward the third row. Dr. Robert Chin, cardiologist, and Dr. Lisa Chin, pediatrician. Every head in the auditorium turned toward my parents, who looked like they wanted to disappear into their seats. For 6 months I tried to get my doctor parents to take my symptoms seriously, I said. Instead they diagnosed me with tension headaches and stress-related somatization. I clicked to a slide showing the timeline of my communications with them. I was told I was being dramatic, that I was catastrophizing normal physiological responses, that I needed better pain tolerance and stress management skills. Another slide, the ER records they'd never requested to see. While other families rush their children to medical care for much less serious symptoms, my physician parents used their medical training to justify ignoring clear signs of neurological emergency. I could see several doctors in the audience glancing uncomfortably at my parents. The irony is that any first-year medical student reviewing my symptom presentation would have ordered neurological imaging immediately. But my parents' overconfidence in their diagnostic abilities prevented them from seeking appropriate consultation. Dr. Williams stepped forward. This case raises critical questions about how medical professionals approach family health concerns. The very expertise that makes physicians excellent clinicians can become a liability when treating family members. The question period that followed was brutal. Doctor after doctor asked pointed questions about medical family dynamics, diagnostic protocols, and professional responsibility. Dr. Chin and Dr. Chin, one physician finally addressed my parents directly. How do you respond to this case presentation? Dad stood up slowly, his professional composure shattered. We had no idea. Lisa never told us she'd had surgery. We thought we were being good physicians, Mom added, her voice breaking. We were trying to prevent unnecessary anxiety and over-medication for what seemed like stress symptoms. But you never ordered diagnostic tests, Dr. Williams pointed out. You never consulted neurology. You never followed standard protocols you'd use for any other patient with these symptoms. We failed, Dad said simply. As physicians and as parents, we completely failed. The conference ended with Dr. Williams announcing new protocols for medical professionals treating family members, including mandatory consultation requirements and bias awareness training. Afterward, my parents found me in the hallway outside the auditorium. Other doctors were still approaching me, sharing similar stories of medical family bias they'd witnessed or experienced. Lisa, Mom said, tears in her eyes. We're so sorry. We had no idea how serious. You had every opportunity to find out, I said gently. But you chose to trust your assumptions over my actual experience. How can we make this right? Dad asked. By learning from this, I said. By understanding that being a doctor doesn't make you infallible, especially with family. By remembering that patients know their own bodies better than you know their symptoms. 6 months later, my parents had become advocates for medical family bias awareness. They spoke at conferences about their mistakes, helped develop new protocols for physician-family care, and created educational materials about diagnostic overconfidence. Our relationship slowly rebuilt, but on different terms. They learned to listen to my health concerns like doctors should listen to any patient. They learned to separate their professional egos from their parental responsibilities. The brain tumor was gone, but the scar remained, both the surgical scar on my scalp and the emotional scar of navigating a life-threatening illness without family support. But from that scar grew something valuable: research that would help other patients, protocols that would save lives, and a family that finally understood the difference between medical expertise and medical wisdom. My parents' medical licenses didn't literally tremble, but their confidence in their own infallibility was permanently shaken. And that turned out to be exactly what they needed.